has been produced by the International Stoke Mandeville Wheelchair Sports Federation as a guide to the new functional classifications. Most benefit will be gained by viewing the tape in conjunction with the relevant technical documents. The tape is divided into two parts. Part 1 looks at track and field events, and Part 2 at shooting, swimming, snooker, basketball and table tennis. Initially, it will be important to know the neurological level of the athlete. This not only includes the motor and sensory level, but also whether the athlete is incomplete or complete. The presence of a curved spine and of joint contractures is to be noted. A joint contracture is the inability to move a joint through its normal range. Difficulties in classification will occur more frequently in the athlete who is new or untrained or has poor technique or poor chair position. The top athletes are generally easier to classify because they are usually using their functional potential. In the T1 functional class, athletes may use elbow flexors to start. That is the back of wrist behind the pushing rim. Hands stay in contact or close to the pushing rim with the power coming from elbow flexion. The old technique is to use the palms of the hands and to push down on top of the wheel in a forwards direction. Athletes have functional elbow flexors and wrist dorsiflexors. They have no functional elbow extensors or wrist palmar flexors, and may have shoulder weaknesses. In the T2 class, athletes usually use elbow flexors to start, but may use elbow extensors. Power from pushing comes from elbow extension, wrist dorsiflexion and upper chest muscles. Additional power may be gained by using the elbow flexors when the hands are in contact with the back of the wheel. The head may be forced backwards by the use of neck muscles, producing slight upper trunk movements. Athletes have functional elbow flexors and extensors, wrist dorsiflexors and palmar flexors, and functional pectoral muscles. They may have finger flexors and extensors. The T3 class. Functionally, athletes have normal or nearly normal upper limb function, but they have no active trunk movements. When pushing, the trunk is usually lying on the legs. The trunk may rise with the pushing action. Usually use a hand flick technique for power or friction technique. They may use the shoulder to steer around curves, but will usually interrupt pushing movements to steer and have difficulty resuming the pushing position. When braking quickly, the trunk stays close to the pushing position. Scoliosis, curvature of the spine, usually interferes with abdominal and back muscle function. Athletes have no abdominal muscle function and may have weak upper spinal extension. Finally, in the track section T4, athletes have backwards movement of the trunk, they usually have rotation movements of the trunk, and may use trunk movements to steer around curves. Athletes usually do not have to interrupt the pushing stroke rate around curves. When stopping quickly, the trunk moves towards an upright position. They also use abdominals for power, particularly when starting, but also when pushing. In F2, athletes have difficulty gripping with the non-throwing arm. In the shot, they are unable to form a fist and therefore do not usually have finger contact with the shot at the release point and are unable to spread the fingers apart. In the discus, they have no functional finger flexors and they are unable to form a fist. They have difficulty placing fingers over the edge of the discus, but may do so with the aid of contractures or spasticity. In the javelin, athletes usually grip the javelin between the index and middle fingers. These athletes may have slight function between the digits of the hand. In the F3 class, athletes have nearly normal grip with the non-throwing arm. In shot, a good fist can usually be made. They can spread the fingers apart, but not with normal power, and can grasp the shot put when throwing. In discus, they have a good finger function to hold the discus. They may be able to impart spin on the discus and are able to spread and close the fingers, but not with normal power. In javelin, they usually grip javelin between the thumb and the index finger and have ability to hold the javelin because of presence of hand muscles that spread and close the fingers. F4 athletes in the shot, discus and javelin have no sitting balance. They usually hold onto part of the chair whilst throwing. Complete Class 2 and Upper Class 3 athletes have normal upper limbs. They can hold the throwing implement normally, but have no functional trunk movements. F4 is also for incomplete 1C athletes who have trunk movements, but with hand function like F3.
Was it 51 degrees if you wait at the moment?
F5 class. 3 trunk movements may be seen in this class. Off the back of a chair in an upwards direction, movement in the backwards and forwards plane, and some trunk rotation. Athletes have fair to good sitting balance, but they cannot have functional hip flexors, that is, ability to lift the thigh upwards in the sitting position. They may have stiffness of the spine that improves balance, but reduces the ability to rotate the spine. Shot and javelin F5 athletes tend to use forwards and backwards movements, whereas the discus predominantly uses rotatory movements. Athletes have normal upper limb function and abdominal muscles and spinal extensors, upper or more commonly upper and lower. They may have non-functional hip flexors, grade 1, and have no adductor function. In F6, shot, discus and javelin, athletes have very good balance and movements in the backwards and forwards plane. They have good trunk rotation. They can lift the thighs, that is, off the chair, hip flexion, and compress the knees together, hip adduction. Athletes may have the ability to straighten the knees, it's knee extension, and may have some ability to bend the knees, knee flexion. This is transmitted movement, that is, movement caused by trunk rotation, producing a passive leg movement.
Oh, God. Hey. No throw.
F7 athletes in shot, discus and javelin have very good balance and movements in the backwards and forwards plane. They may also stand up when throwing. They usually have very good balance and movements towards one side, due to presence of one functional hip abductor on the side that movement is towards. Athletes can usually bend one hip backwards, that is, push the thigh into the chair, and can usually bend one ankle downwards, that is, push the foot onto the foot plate. The side that is strong is important when considering how much it will help functional performance. The F8 class in shot, discus and javelin is for standing athletes with not more than 70 points in the lower limbs. Some factors to consider when observing a field athlete are the grip of the throwing implement and the grip of the non-throwing arm, the starting position, release position and finishing position of the throwing arm, and the functional use of the non-throwing arm. For example, is elbow flexion used or elbow extension, or is the arm used to control trunk movement after release of the implement? And also consider trunk movements. Off the back of the chair, upwards, forwards and backwards, rotation and side to side. Also think about pelvic stability and leg movements. And don't forget the trunk rotation test. In F4, no abdominal function. In F5, abdominal function. And in F6, abdominal function plus functional movements in the upper parts of the lower limbs. There are 4 shooting classes, SH1 to SH4. It is very difficult to hold the weight of a gun still whilst firing on target. The centre of gravity of the body is raised when either a pistol is held at arm's length or a rifle is aimed. The ability to counter this is vital to the shooter and is taken into consideration when classifying shooters. Only the minimum of support is allowed to maintain a stable position, so such things as armrests, high chair backs and very deep chair backs are not allowed. The positions and terms in able-bodied shooting are used in wheelchair shooting competitions, and so we find in rifle shooting 3 positions. The most difficult of these is standing, where the rifle is held with one elbow against the rib cage as the only support. The wheelchair-bound shooter does not actually stand, but assumes the same stance with regard to the rifle as the able-bodied shooter whilst seated. Classification of shooters is carried out by a team consisting of a doctor and a shooting technician. Both a physical and practical examination are performed during the one session, with the practical examination being undertaken in the standing position. In kneeling, the position of intermediate difficulty, one elbow is rested on a table which is usually attached to the chair. This resembles the position assumed by the able-bodied shooter who rests one elbow on the knee whilst kneeling. In prone, the maximum support is allowed with both elbows resting on the table. Classes SH2 and SH3 are both reserved for seated shooters. SH2 contains shooters from the former ISMGF paraplegic shooting class and is divided into two subclasses. SH2B being for those with poorer balance, and to compensate, these shooters are allowed a higher backrest. SH3 is roughly akin to the old ISMGF tetraplegic class and is for those with poor balance and who have some loss of functionality of the hands. SH4 shooters are those who are unable to hold the weight of a rifle and therefore must use a shooting stand. There is no pistol competition for SH4 shooters. However, a shooter could be a Class SH4 rifle shooter, and because of an inability to hold a rifle, hold another class for pistol. And some competitors even use a mouthpiece and small bellows to fire, as they do not have the strength in their fingers to pull the trigger. Wheelchair basketball attracts participants with various levels of physical ability. To ensure fair competitive opportunities for all athletes, a classification system has evolved that recognizes the functional abilities of athletes and gives them a point value. The classification measures the player's volume of action while executing basketball skills, as opposed to the player's power, technique, or ability. Observe player number 9 in white. This type of player is not able to perform active rotation of the trunk and lacks abdominal muscles. Generally speaking, thoracic level 7 paraplegics and above are categorized in Class 1. Observe player number 14 in red. This type of Class 2 player has trunk rotation, active stability, and is generally speaking thoracic level 8 through lumbar 1. Observe player number 15 in blue. This type of Class 3 player has good mobility in the frontal plane and can therefore lean forward and return to an upright position without pushing off with his arms. Generally speaking, they could be categorized as lumbar 2 to lumbar 4 paraplegics. The other players are Class 4, such as this player, number 11 in red. This type of player has active mobility in all planes and can therefore lean at least to one side, sometimes using hip abduction to maintain balance in the chair. Generally speaking, these athletes have lumbar 5 function or lower. Most athletes fit readily into these 4 classes. However, there are exceptional cases where extenuating circumstances warrant the issuing of a classification which is of a half-point nature. Table tennis is divided into 10 classes. Classes 1 to 5 for wheelchair and 6 to 10 for standing. This tape looks at the wheelchair classes. Class 1, formerly ISMGF Class 1A, and Class 2, formerly Class 1B. Class 3, spinal cord, that's ISMGF C8 to T7 complete, with no sitting balance, no trunk rotation, but with good hand function. Class 4, spinal cord T8 to L1 complete, sufficient sitting balance and trunk rotation, and Class 5, spinal cord L2 to S2 complete. Balance and trunk movement in sagittal plane or with use of appliances, braces or hip extensors, etc., which give pelvis control. For snooker players, the new functional Class 1 is equivalent to the old 1A, 1B and complete 1C classes of ISMGF. In other words, those tetraplegics with no trunk function. An abnormality of one arm would qualify a player for this class. Thumb function must be considered. The anatomical level is C8. Class 2 includes players with normal or functionally normal hands, that is, they can make a bridge, and who have poor balance. Those players who use their arms for support and have no functional abdominal muscles or lower spinal extensors. The anatomical level is T1 to T7 inclusive. And Class 3 is for all other players wishing to play snooker in a wheelchair. Minimal disability is a significant abnormality in one limb, preventing a player from playing standing up. Swimming is functionally classified into 30 classes. S1 to S10 for freestyle, backstroke and butterfly, B1 to B10 for breaststroke, and M1 to M10 for individual medley. In this tape we're looking at some of the S classes. S1 is for very severe quadriplegic with poor head and trunk control, for instance CP1. S2 is for tetraplegic, complete below C5 to 6. Severe muscular dystrophy, amputation of 4 limbs. Class S3 is for tetraplegic, completed below C6. A lower tetraplegic with an additional handicap or severe muscular dystrophy. S4 class is for tetraplegic complete below C7, some incomplete C5, polio with unfunctional hands for swimming, muscular dystrophy comparable with C7. S5 class would be complete tetraplegia below C8, incomplete C7 or C6 with ability to keep legs horizontal and functional hands for swimming. S6, complete paraplegia below T1 to T8, incomplete C8 with ability to keep legs horizontal. S7 class, complete paraplegia below T9 to L1, double above the knee amputee shorter than a half. S8 class, paraplegia L2 to L3 with no leg propulsion but ability to keep legs straight, double above the knee amputee, double below the knee amputee, not longer than a third. And class S9, paraplegia L4 to L5, polio with one unfunctional leg, single above the knee amputee, double below the knee amputee with stumps longer than one third. And class S10, polio or cauda equina lesion with minimal affection of lower limbs, single below the knee amputee, double forefoot amputation. For further information, contact the International Stoke Mandeville Wheelchair Sports Federation, Haywood House, Ludwig Gutmann Sports Centre, Barnard Crescent, Aylesbury, Buckinghamshire, and the postcode HP21 9PP in the United Kingdom.